Hey, Dr. C here with you. Let's talk about Hashimoto's versus Graves' disease, how these things are similar and how they're different. For starters, they're both autoimmune disorders and they're both thyroid diseases. Now, the thyroid gland is a little thing, kind of like the shape and size of a bow tie, kind of about the location of a bow tie as well. And it makes hormones that govern how well we generate fuel, how well we repair our skin, hair, and nails, how well our gut works, how well our bodies have regular menstrual cycles. So they affect a lot. And sometimes they can go wrong. The glands can become enlarged, they can get nodules, they can get cancer, they can make the wrong amount of hormones. So the wrong amounts of hormones, we call that hypo when there's too little, or hyper when there's too much. Think about like a hyperactive child, they're overactive. And same thing for the thyroid. Now, almost all thyroid disease comes about from autoimmune disease. And what is autoimmune disease? Well, the immune system, imagine like a home security guard. And this guard protects you. You know, if there's some scary looking burglar, wearing a mask and trying to break into your house, the security guard would chase them away, right? Well, if that security guard were to chase away or hassle your mailman, that would be wrong. The mail person is not dangerous, they belong outside your home, they're normal. You could think of that as an allergy. That's a case where the immune system attacks something from outside of you that's not dangerous. But if that security guard attacked your dog, well, your dog is not only harmless, but it belongs inside your house. You could think of that as an autoimmune disorder. That's a case where the immune system attacks something that belongs inside of your body. So Hashimoto's and Graves are the main two autoimmune forms of thyroid disease. And generally, Hashimoto's is the main cause of hypothyroidism, and Graves is the main cause of hyperthyroidism. We'll talk more in depth around that, but they're the most common ones. So when we think about where these names come from, a lot of these medical names are just the names of doctors who discovered them some time back. Hashimoto's was documented from a Japanese doctor back in 1907. Graves was from a European doctor in the late 1930s. And Graves especially, you think about like a grave, like someone's dead, like a cemetery, and that's scary. All respect to Dr. Grave, there were other doctors identifying this same autoimmune hyperthyroidism around the same time. Some places called this von Badstow's disease. That's kind of exotic, but not as scary. So yeah, Graves doesn't mean death or dying. That's not a necessary part. And here's a weird thing. So Hashimoto's main cause of hypo, Graves' main cause of hyper, they're almost the same disease. They're very similar, which is kind of odd. The genes for thyroid disease are genes of iodine tolerance. And so those who don't tolerate iodine as well are more prone to develop various versions of autoimmune thyroid disease. And there's different parts of the thyroid that one might attack. So the thyroid is one of many glands, and as such, it's controlled by the pituitary and the hypothalamus within the brain. The cycle is that your thyroid, it's going to just relax and do nothing until it's told to work. And then it'll work in proportion to how loud that signal is. If you just talk normal level, it'll work a normal amount. If you yell at it, it'll work harder. If you talk very quietly, it'll slow down and work more slowly. And that signal is the TSH. It's the thyroid stimulating hormone. And there is a receptor for TSH outside the thyroid. So your pituitary puts some TSH in the bloodstream, it hits the receptor, your thyroid says, oh, I'm being told to work, I better work this much, because there's this much of a signal. So with Graves' disease, the mechanism is that the immune system attacks the receptor. So what does that mean? Well, I'm looking at my door. Imagine that the doorbell had a short circuit and it was always going off. There may not be anyone there, but I kept hearing the doorbell, so I kept going out and opening the door. I kept responding to it, even though there was nothing there. That's kind of what Graves' autoimmunity is like. So your pituitary, your body has sensed that your thyroid is out of control. There's too much hormone there. So your brain has chosen to stop making TSH. You've made it down to almost none. But that still doesn't slow the thyroid. And your thyroid, even though there's no TSH there, it thinks it's being told to work. It thinks TSH is there, and therefore it makes all this extra hormone. It thinks it's being yelled at. But the thing is, your brain is not talking to it. These immune cells are giving it the wrong signal. So it's releasing all this hormone your body doesn't want. So that's Graves' disease. With Hashimoto's, there's an enzyme that activates iodine called thyroid peroxidase, and there's a protein that stores iodine called thyroglobulin. And with Hashimoto's, those things are generally part of the immune attack. Now, not everyone with Hashimoto's has measurable antibodies against those. I won't put a lot of depth into that right now, but that's generally part of the mechanism of Hashimoto's. So with Hashimoto's, you're attacking things within the thyroid that let it make hormone. And with Graves', you're attacking that doorbell. And so the thyroid thinks it's being told to work when it's not. So how often is hypothyroidism from Hashimoto's? Well, about half of people with hypothyroidism have measurable Hashimoto's antibodies. But a lot of folks with Hashimoto's don't have measurable antibodies. So we don't have perfect numbers, but most estimates would say that about 95 to 97% of hypothyroidism comes from Hashimoto's. And so if we flip that and say hyperthyroidism, well, Graves' disease causes about 80% of hyperthyroidism in adults. Other causes can include toxic nodular goiter, pituitary abnormalities, acute short-term thyroiditis, and other things that are more rare. So about 80% of the time, hyperthyroidism is from Graves' disease. Now, Hashimoto's, we think about the thyroid peroxidase, the thyroglobulin antibodies. They can show up in Graves' also, but there's a specific one called thyroid stimulating immunoglobulin. This is an example of a thyrotropin receptor antibody. So I threw in a new word, thyrotropin. That's another name for TSH. My apologies, but medicine, the whole world of medicine insists on having multiple names for the same things and multiple acronyms for the same things as well. So yeah, thyrotropin means TSH. And there is a receptor that attacks thyrotropin. And it gets kind of weird because the thyrotropin receptor antibodies, they might block thyrotropin or they might activate it, like that short circuit in the doorbell. So they can make your thyroid deaf to TSH, or they can make your thyroid think there's TSH when there's not. Most commonly, they cause it to do the second, make it overactive. And the main one there is called TSI. Easy to remember because it's almost the same as TSH. Now, with Graves', there's a much tighter overlap between having Graves' and having TSI than there is between having Hashimoto's and having thyroid antibodies. About 90 or 95% of those with Graves' will have measurable TSI levels. And if you get to someone where they've had it for a full year, then you're at that high 95 part. So it's almost always there. So with Hashimoto's, we think about the main symptoms being the hypothyroid symptoms, too little hormone. Classic ones are going to be fatigue or weight gain or hair loss. And with Graves', we think about the classic hyperthyroid symptoms. Those can be the nervousness, the high heart rate, the tremors, the sweats, the jitters, maybe weight loss. But I want to not make those like there's a wall between them. At the extremes, the extreme levels of low or the extreme levels of high, the symptoms are more distinct. But few people are at those extreme levels. Most have mild to moderate hypo or hyperthyroid levels. And this is weird, but it's true. When you're at mild or moderate hypo or hyper, you can have interchangeable symptoms. So not only could they change from day to day, but you could consistently have hypothyroid symptoms when you're hyperthyroid. And this is also true if you're taking too much medication. It can cause weight gain. It can cause fatigue. So yeah, that's not intuitive, but it's totally true. So I don't really talk about hypothyroid symptoms or hyperthyroid symptoms. I talk more about thyroid symptoms. And the important point there is to know that the symptoms can come from either case. And that's why it's important to really understand where someone's levels are and what the needs are to get higher or lower. With Hashimoto's, if it is causing hypothyroidism, then the main treatment would be thyroid medication. In most versions of Hashimoto's, it's not causing full hypothyroidism. It's not actually slowing the thyroid. It's threatening the thyroid, it's putting it more at risk, but it hasn't slowed down just yet. And those are cases to where diet therapies work really well. Diet and nutraceuticals can help Hashimoto's for the vast majority of people, like over 90%. Many are given thyroid medications like levothyroxine or natural thyroid for Hashimoto's, but they don't actually help Hashimoto's. Now, Graves' disease, there's three main categories of treatment. There's medications to slow the thyroid, there's radioablation to destroy the thyroid, and there's surgery then to remove it. The medications are most common for initial steps. What they do is they make the thyroid not absorb iodine as well. Did you hear that? And eventually that slows how much hormone it releases. So if you're consuming less iodine, then they work better and you don't need them as long. And there's actually a really high chance of going into remission from Graves if it's managed well. So the Thyroid Reset Diet is important in that context. Now, here's another case that's not intuitive. With the thyroid, there's a window of iodine that's good, and too much or too little can cause the same kinds of problems. But most people that are prone to thyroid disease, their genes make it to where too little is not likely, but too much is really common. So with Hashimoto's now, those enzymes that we attack, the thyroid peroxidase and the thyroglobulin, again, they're all about iodine. One is where we store it, and one is how we get it in. So if there's less coming in, there's less of an immune attack. So the same approach can actually help both of those diseases. And that's why the Thyroid Reset Diet can be effective for both. Now, some with Graves don't respond to medication. And Graves can be life-threatening. You know, the cardiac damage can be acute. There's a thing called thyroid storm. That's where the thyroid makes so much hormone that the extra hormone worsens the immune attack that releases extra hormone. So it gets to be a vicious cycle. And that can be fatal unless it's managed aggressively. So some cases do need radioablation or surgery or ER care for thyroid storm. But those are rather rare. Those are rather unusual. Most can do well by needing medication short-term to slow the thyroid and doing diet therapies along with them to become more effective. Once the thyroid has slowed, somewhere about a third of people may lapse down into hypothyroidism. But those same diet and lifestyle approaches can make that less likely and make that less of a risk for them. With Hashimoto's, most people can reverse and lower the autoimmunity and prevent themselves from going into overt hypothyroidism. In fact, even if they still have some degree of thyroid antibodies, their risk in a given year of their thyroid shutting down is only about 1.7%. So these things we manage very well with diet, lifestyle therapies. Diet's the cornerstone, it's best documented, but all ways that make you healthier make your thyroid healthy and help you feel better and cut the odds of worse problems. So yeah, sleep and relaxation and exercise and healthy wide range of foods, fresh air, time in nature, good social connections. These things all matter. But clinical trials have shown that diet alone, specifically the outlined approach in the Thyroid Reset Diet, can reverse these things the vast majority of cases. If you've got Graves, please also work with a doctor to make sure your thyroid has slowed. Sometimes if it's out of control, it won't respond until it's slowed down initially. And then if you've got Hashimoto's, make sure you don't have overt hypothyroidism. That may need medication. But Hashimoto's, even when it's not shutting down the thyroid, can cause symptoms and cause problems. And you can help that in nearly all cases by diet and lifestyle changes. All right, that's the core message. Dr. C with you. That's how Graves and Hashimoto's are different. Take great care. We'll see you soon.